Naobserbahan ng mga kinaukulan na mistulang wala ng pandemya base sa mga ikinilos ng marami sa ating mga kababayan nang pairali ng Alert Level 1 sa Metro Manila at malaking bahagi ng bansa. Ang Department of Health nagbabala na sa maaring pagdami muli ng COVID-19 cases pagkatapos ng papalapit na eleksyon sa Mayo 9 dahil sa tila pagbaliwala na nga sa minimum public health protocols. Ito ay sinigundahan ni World Health Organization Country Representative Dr. Rahendra Yadav.
As we expected, we saw people going in and out of Metro Manila to meet their family members, also on tourist destinations. So whether this social mixing and increased mobility during Easter will cause increase in cases or not depends on whether people wore masks and avoided crowds and poorly ventilated places, and also whether we are testing enough people. So now government is prioritizing testing among high risk groups, and we are not testing as much we were testing in the previous months. So number of cases should not we should not rely on the number of cases to know whether we have too much COVID or not. Rather, we need to focus on increasing our vaccination.
Ang paglobo ng mga kaso ayon pa sa DOH ay maaaring humigit pa sa naitala ng manalasang Omicron variant sa bansa noong Enero. Iginiit ni Yadav na napakahalaga na maitodo na ng gobyerno ang vaccination rollout.
So the national government has already done a tremendous commendable job of ensuring that we have enough vaccines. Now it is up to the local government units and local chief executives to ensure that the vaccines reach the people who are still not vaccinated. So 50-60% of the people who had better access to vaccines, they could afford to travel, they could afford to miss their work time, they got vaccinated. So we have reached 60%, around 60% vaccination if we take total population as the denominator. But unfortunately, many barangays are still nowhere close to 70%. Actually, we need to go even much beyond 70% to create adequate herd immunity. So the local chief executives of the places where barangays have low coverage need to step up the reaching the unreached through last mile approach.
Payo pa ng opisyal magsagawa na ng house-to-house vaccination hanggang sa kasulok-sulukan ng mga bayan na hindi pa naaabot ang target na bilang ng mga bakunado.
Using house-to-house vaccination and close-to-home vaccinations. So just if vaccinators sit at the vaccination sites, that's not adequate. We have to reach out to these people who may have more challenges of access. Especially people who are elderly, they may not be able to travel even 20-30 minutes or may feel discouraged if they have to travel. So rather than waiting for them in vaccination sites, we have to reach out to them and get vaccinated. That's the best thing we can do.
Pagdidiin lang din ito, napakahalaga na maipagpatuloy ang sapat na bilang ng testing para malaman kung nakapasok na sa bansa ang mga variants of concern na sakit na ulo na ngayon ng ilang bansa.
Recommends that we can prioritize high-risk groups for testing. So there is not a fixed number we can give. Ideally, we should test everyone who are at high risk, including frontline health workers and vulnerable groups like elderly people. But yes, if resources are there, then we can test more numbers like developed countries do. But rather now the focus should be on more vaccination. Our resources should go to getting more people vaccinated.
Sa pagtatansya ng Subtechnical Working Group on Data Analytics, bumaba ng 7% hanggang 12% ang pagsunod sa minimum public health standards tulad ng social distancing at pagsusuot ng mask noong Marso at ngayong Abril. Base sa disease models, ang 20% hanggang 30% na pagbaba sa pagsunod sa health standards ay maaring magresulta sa halos 35,000 hanggang 300,000 active cases sa kalagitnaan ng Mayo.
Yes, I have seen those numbers. So we have to prove those numbers wrong. That's the challenge we face. If we have the low coverage that we have with vaccines in many barangays and many provinces, and if we relax our guards, if we relax our defenses, then yes, it's possible to get to those numbers because in Korea, which has South Korea, which has half the population of the Philippines, they have already touched 600,000 cases per day. That's huge. And there is no way of saying how that will affect the Philippines if we lower our guards. The good thing is that Filipinos are one of the best in terms of wearing a mask. So that needs to continue. There was some decline recently in the mask wearing. That should not happen. And we have to cover our people with vaccines. So these are the two best things we can do, masking and vaccination.
Samantala, ang DOH sinabing maaring simulan ngayong linggo ang pagbibigay ng second booster shot sa ilang sektor, sa senior citizens, medical frontliners at ang mga may comorbidity. Sinabi ni Health Undersecretary Mirna Kabutahe, hinihintay na lamang ang pinal na rekomendasyon ng Health Technology Assessment Council dahil ang Food and Drug Administration ay nagbigay na ng go signal sa second booster shot rollout. Si Yadav, sinabi na ito ay depende na sa gobyerno.
So yes, some countries are using the second booster dose. Generally, we recommend that governments decide on the basis of availability of vaccine. The good thing is that the world does not have shortage of vaccines anymore, and definitely if countries have enough vaccine, as is the case in Philippines, then high risk groups, especially the elderly, would definitely benefit from a second dose about 6 months after the second booster dose after the first booster.
Escosio, Radyo Inquirer Online, bayan nagtatanong, mamaya nag-uusisa.